chains of the arms and chest. Great for practice because it's super, super quick and how to treat those. And I'll just quickly show you how to use a PNF to utilize that. Byron, can you face up on the table, please? And I'll get your head just resting a little bit. Okay, my favorite little fascial assessment of the chest, usually I do after my little reset. Some of you guys have already seen me do my reset where I do like the arm through here, bring the shoulder back, and then I bring the arm up, all the way up, kind of sort of. You guys have seen me do variations of that, right? Kind of sort of. All right, well, I usually do that whole like shoulder reset before I do this assessment, because this assessment I utilize to see, okay, where have I missed or what areas still need work. Okay, Byron, I'll get you to bring your arms straight up to the sky for me, please. Good. Sky's up here. Thumbs towards me, that's a big thing. A lot of people end up coming up like this, so make sure thumbs towards you. And you're gonna first drop outwards for us, please, as far as you can, as far as you can. Now, we're not just seeing how far he can go, but you wanna see the quality of that movement. I'll do that one more time and see if you see what I saw. Nice and slowly, go ahead and let your arms fall. Which arm hit the table first? Right. The left arm actually hit the table first.
The right one seems
you
to
might have saw that
disappear.
this one actually went slower than his other one, right? So this one needs work in this chain. The next chain, straight up. We're gonna come straight back.
Oh,
You see this right here? Right? So his left side is restricted in through that lateral inferior chain, and his right side is also restricted in that inferior lateral chain, but not as much, right? Watch what happens when I get him to externally rotate. Right? His arms drop right back, but you can actually see the restriction is now on this side here on that. But you can actually assess the different fascial chains depending on which way you have their arms rotated. Right? So when you bring people's arms back like this, make sure they aren't externally rotating because you will not be testing that inferior lateral anterior chain. Okay? So this one's assessing that inferior lateral but more anterior chain. As soon as we go this way, it's the inferior lateral posterior chain. Can you kind of see that? So try that when you have a chance with your patient on the table. Just try thumbs towards you and coming down, how you can feel it through the front. And then if you allow them to externally rotate and you come up, you can actually feel it through the back structures. Okay, so this is the one he was most restricted in. Yeah, that actually loosened up quite a bit already. Yeah, that did loosen up quite a bit. Okay, so now he's more restricted in this one here a little bit. We'll see if we can gain him just a little bit of more motion with that, using a little bit of PNF. So for this one, I would normally challenge right into the inferior aspect of the axilla. Let that drop, let that drop. So literally elbow just traces the triceps until we land in that pocket of the axilla. Remember, we don't want to be in the axilla. We got sensitive structures in there. We don't want to have them lose sensation to their hand. So tracing down the triceps until you hit that muscular junction in the posterior axilla. Okay? Let your arm drop. Good. Nice big breath in and out. So I'm literally loading in, trying to pick up slack in that fascial chain. If I would like to increase the effectiveness of this, Byron, I'll get you to try and pull your elbow down towards your side into my hand. Good. Hold for 5, 4, 3, 2, 1. Let go, breath in. And when he breathes out, I bring it further and load into that attachment even more. So go ahead and push into my hand. Hold for 5, 4, 3, 2, 1. Let go, breath in and out. And again, it is just enough contraction so that you can feel their tissues just pop out underneath your contact. Now let's see how we did. Arms up to the sky and straight upwards as far as you can go.
Oh, wow.
Right, now we'll do the same with the other side, see if we can get him a little bit of range, again, just as quickly. Good, elbow down the triceps until I find that junction in the posterior axilla. Right there, let that drop, let that drop. Good, nicely breath in and out. So this one, it's more the lateral aspect, so I'm actually coming in rather than straight down. Let that go, let that go. Good, and nice and gentle, pull your elbow down into my hand. Hold for 5, 4, 3, 2, 1. Let go, breath in and out. Good, all the way, all the way. And then another one that I like to use to try and challenge that chain in particular is this one. Good, Okay, Byron, I'll get you to try and pull your elbow down to your side for me. Hold for 5, 4, 3, 2, 1. Let go. Breath in and out. Good. Let it go. Let it go. Let it go. Good. Try and do a side crunch for me. Hold. 5, 4, 3, 2, 1. Let go. Breath in and out. You saw how I asked him to activate further down in the chain? Good. Byron, arms up to the sky. And almost. But you see how quick that is? We can actually balance out those chains way quicker than going in and trying to strip all that things and whatnot. All right, so do we have any questions right now? Keep in mind, this is not going to be the first time you guys are encountering it, so don't be concerned if you don't quite get it, if it doesn't quite make sense, or if you're not quite connecting the dots. That's okay. This is literally just the intro. All right, we're going to talk about this again in lower spinal, and then if you guys have me come in to talk to your class for advanced practice, then we'll touch base on it again when you guys have a more thorough understanding after having gone through upper and lower spinal. All right, so do we have any questions about your introduction to this idea? Remember, it's just an introduction. All right, what time is it? 11:45. 11:45? Cool. Well, you guys don't have to get undressed. So do just partner up with someone, check out the fascial chain, see if you can feel lines of tension, either face down, face up, try the